So in this table, we are going compare and contrast different antibiotics. And also we are going to discuss some side effect and keynote. Each and every information from this table super important for NCLEX board. Every note is collected from NCLEX question. So we are going to learn NCLEX board question. We are going to share the information what is related directly to the NCLEX board. Like here, all is antimicrobial, but different types. Different antibiotic has a different indication. In the first group, antimicrobial tetracycline. So tetracycline is a common name. What are the example in this group? Example is called doxycycline or demicycline, minocycline. All of them together is called tetracycline, right? So what are the indication of tetracycline? Tetracycline we use for bacterial infection. Tetracycline we can use for acne or Lyme disease. Tetracycline more commonly used for urinary tract infection, right? But NCLEX board most of the times asks about what are the side effects of tetracycline. As example, like you are LPN or RN, your patient prescribed by tetracycline, if you do not know the side effect, how you can negotiate to the healthcare provider. So the common side effect of tetracycline, they can cause GI upset. Okay, so GI upset means nausea, vomiting, and diarrhea. Also, smooth denture discoloration, photosensitivity, and super infection, especially yeast infection. The beauty of this note I wrote here, you see, side effect of tetracycline, side effect of erythromycin, side effect of aminoglycoside, and also sulfur methoxyl trimethoprim side effect. So you see the common side effect like GI upset, also GI upset. The same color, this 3 antibiotic can cause GI upset. Like erythromycin or azithromycin can cause ototoxicity. Aminoglycoside also can cause ototoxicity. The tetracycline can cause hepatotoxicity. This medication, sulfur methoxone trimethoprim, also cause hypersensitivity, right? But it's called hepatotoxicity, liver problem, and this is an allergic problem. So when you compare and contrast, it can help you a lot. But we are going to focus right now tetracycline. I can share something most important point about the tetracycline. So NCLEX board asks, if your patient take the tetracycline, what you could do? We have to check the liver function test because they are hepatotoxicity. So tetracycline can cause photosensitivity. So we tell our patient to avoid the sunlight. And tetracycline is very powerful antibiotic. Sometimes they can cause super infection, especially yeast infection. What are the key points for NCLEX board about the tetracycline? Super important, my friend. So do not give to the pregnant women or child under the 8 years old. So when you prescribe this medication, you could ask the patient they are pregnant or not. So do not give a pregnant or nursing mother because they are teratogenic. Okay, the tetracycline can cause photosensitivity. So tell your patient to avoid the sunlight. So keep out of direct sunlight, right? So take empty stomach with a full glass of water. Also decrease the effectiveness of oral contraceptive or CP. So decrease the effectiveness. So the couple, if they married and want to contraception, tell them to use defined method like a barrier method. Also dairy products such as the milk or food is contain high calcium or antacid decrease the absorption of tetracycline. Let me recap this one. It is because it is very important for NCLEX board. The tetracycline can cause photosensitivity, nephrotoxicity, or hepatotoxicity. Also keep out of direct sunlight, or we could monitor the liver enzyme or monitor the kidney function, right? So kidney function or kidney input, urine input and output indicate kidney working or not. And we do not give tetracycline if the pregnant mother or nursing mother. And we do not give tetracycline with a cow milk or dairy product. And do not give to the children if under the 8 years old because they cause permanent discoloration of denture. Also, give this medication with a straw and avoid giving with a Lasix. That is more enough for tetracycline for NCLEX board. Now go to the second antibiotic here, and that one is called macrolide. Macrolide is a group of medication. Basically, in this group, there are few members like azithromycin, erythromycin, clarithromycin, and clindamycin. All together, we call macrolide, right? The macrolide has a common side effect. They can cause nausea, vomiting, and diarrhea. And these three sign symptoms together we call GI upset. Sometimes this macrolide can cause thrombocytopenia. Thrombocytopenia means reduce the platelet count and patient present with bleeding tendency. So bleeding time go up. Sometimes patient complain abdominal pain or super infection like tetracycline. And also patient develop dysarrhythmias. Dysarrhythmia means abnormal rhythm of the heartbeat or autotoxicity. So macrolide or aminoglycoside both can cause autotoxicity. It is very important. Every student must know azithromycin or erythromycin or clindamycin can cause a major side effect, and this is called Steven-Johnson syndrome, right? And also, what are the key points if we could know for board exam about erythromycin or macrolide? So it is good to take empty stomach with a full glass of water. So if you take with empty stomach, the erythromycin or macrolide absorption will be increased or better. Next antibiotic here, it is called aminoglycoside. So the group of the medication, the member of this group are gentamicin, other name I wrote here, tobramycin, amikacin, neomycin, and streptomycin. Keep note, streptomycin is an antibiotic, but also we use for anti-TB medication, right? So aminoglycoside can cause ototoxicity, nephrotoxicity, and neurotoxicity. So aminoglycoside can cause hearing problem, can cause renal problem, and can cause neurological problem or neurotoxicity like vertigo or ataxia, shortly called neurotoxicity. So my friend, you could know when you give the gentamicin or any other aminoglycoside, if your patient complain hearing impairment, we could notify healthcare provider. If we strictly maintain import and output of urine, if it is imbalanced, we could inform the healthcare provider. We can check the serum creatinine and BUN level to check the kidney function test, right? What are the other information about the aminoglycoside or gentamicin? Aminoglycoside or gentamicin, it is a very powerful antibiotic to treat the condition like meningitis or infective endocarditis or septicemia, right? You see indication serious type of bacterial infection. So what we could know about this group of medication, what I wrote here, the key point for NCLEX board exam. The key point here, you see, monitor the patient for tinnitus or hearing loss because they can cause ototoxicity. Monitor the kidney function test because they are nephrotoxicity. Also monitor the blood level to check the therapeutic index, and also it is good to admit intramuscular or IV. The key point I want to recap one more time. So aminoglycoside causes the ear problem we call ototoxicity, or can cause the kidney problem we call nephrotoxicity. The effect on hearing means ringing or dizziness. So if we see any ringing or tingling sensation, hearing loss, dizziness, we informed healthcare provider. And also aminoglycoside, we do not give during the pregnancy. The another antibiotic like tetracycline, we will not give during the pregnancy as well. right? So, and also it is very important, if patient has any kind of toxicity developed because of aminoglycoside, we give them antidote. The antidote name is called calcium gluconate. Calcium gluconate is the antidote of aminoglycoside, right? The last antibiotic here, it is called sulfur methoxyl trimethoprim. My friend, NCLEX PN board directly asks which antibiotics we use for urinary tract infection. The tetracycline we can use, but if your patient have no problem with sulfur methoxone, we can use this one first, the first line of medication. Or if the sulfur methoxone have any hypersensitivity reaction, we choose tetracycline. So UTI is the main medication, is this one, trimethoprim. What are the side effects of trimethoprim? So GI upset, hypersensitivity, or they can cause the blood dyscreasis. So we could monitor the complete blood count. Complete blood counts in, we can check the WBC count, RBC count, platelet count, neutrophil count, ESR, all, right? Because they can cause blood dyscreasis. The sulfur methoxone trimethoprim can cause photosensitivity, right? Like tetracycline, photosensitivity. So we can tell our patient to wear the sun protect lotion or sunscreen, or we can tell them to take the sun protection basically. So also the crystal urea, they can cause crystal urea, increase the fluid intake level, crystal urea. Other medication name I left for NCLEX board here, this is called nitrofluorantine. So nitrofluorantine we can use for urinary tract infection as well. It's called urinary tract antiseptic. So nitrofurantoin can cause GI upset, can cause hypersensitivity and blood dyscreasis, as trimethoprim. Indication is same, side effect is same, GI upset, hypersensitivity, and blood dyscreasis. So what else? The nitrofurantoin can cause peripheral neuropathy or brown discoloration of urine during the pregnancy. So if you educate your patient, they will informed before. So right, so we can educate our patient about these groups of drugs.